Hi everyone. Let's continue our discussion for lesson 2.1. We were discussing social determinants of health. We looked at the Progress Plus framework. We discussed the importance of socioeconomic status and the health inequities that go along with that if you're living in a low socioeconomic status. We looked at key terms. We reviewed the Sustainable Development Goals. And we ended off by looking at some key Sustainable Development Goals called the Socioeconomic SDGs and their relationship to health. And making progress towards achieving the socioeconomic SDGs will improve the quality of life and the quality of health for billions of people. SDG number 1, No Poverty, sets an ambitious goal of ending poverty in all its forms everywhere. Extreme poverty is surviving on less income than an international poverty line, and that's typically set at an income of less than $1 or $2 per day per person. As you can see from this graph, the percentage of the world's people living in extreme poverty decreased from approximately 35% in 1990 to 10% in 2015. And the SDG number 1 aims to further eradicate that percentage by 0% by 2030. However, as of 2015, the majority of people in many low and middle income countries are still living below the international thresholds for poverty. And as you can see here, India, Nigeria, and Ethiopia. An even higher percentage of people are considered to live in relative poverty, and that's living on less than the nationally defined poverty line in their own countries. So let's look at Canada. Canada's poverty rate has fallen to a historic low in the last 3 years on record, but millions of Canadians still live below the poverty line. So this is Canada's official poverty line. We've decreased down to 8.7%. But 3.2 million Canadians, including 560,000 children, are still living in poverty. So we need to rethink our poverty line. Do we need to change that? Maybe we need to drop our poverty line so we can put more funding into getting people above the poverty line. Because right now, the amount of people living in relative poverty is still very high in Canada. Poverty is tied to health, and that's why sustainable goal number 1 is reducing poverty. Because economic status is so strongly tied to health status, progress towards achieving the SDG number 1 is necessary for progress towards achieving the health-specific SDGs. Living in poverty causes ill health, and ill health causes poverty. It's a vicious cycle. Let's move on to SDG number 4. Both the ability to read and a higher number of years of formal education are correlated with higher health status for adults and their children. Sustainable goal number 4 aims to ensure inclusive and equitable quality education and promote lifelong learning opportunities for all. Many children and adolescents in low and middle income countries are not enrolled in early childhood, primary, or secondary education, and you can see that here on this graph. Since many schools in lower income countries have school health programs that provide hygiene and health education, nutritional support, treatment for common infections, and other health services, children who are not in school miss these critical opportunities for both learning and healthy development. Literacy is the ability to read and write and to apply those communication skills. Functional literacy is taking those literary skills and using them to complete normal daily tasks. And then health literacy is the ability to access, understand, and apply health information. Adult literacy rates have increased in low middle income countries, but in many countries, women lag behind men. And this is a concern because research shows us that female literacy and education are especially important for family and child health. Did you know that women with more years of education have more interactions with the healthcare system and their children are more likely to survive? How do we know that? Well, the percentage of babies born at a healthcare facility increases with maternal education. The percentage of toddlers who have received all basic vaccination increases with maternal education. And the number of children who die before their first birthday is decreased based on maternal education. So it's very important to think about maternal education and the health of individuals in low middle income countries, because there's a real link that if a mother is healthy, her children and family will be healthy. Let's move on to sustainable goal number 5, which aims to achieve gender equality and empowerment for all women. We know women and girls face different health challenges than men and boys because of both biological characteristics related to sex and social structures related to gender. We know that sex is the biological classification of people as either male or female based on genetics and reproductive anatomy, but we know there are differences between men and women due to different body chemistry, hormones, physiology, and brain function. And these differences mean that men and women sometimes have different symptoms for the same diseases and different prognoses and pathways to recovery. For example, men are more likely to have dramatic heart attacks with crushing chest pain, while women often have subtle symptoms like feeling more tired than normal. And this key difference is a key reason why heart disease in women has traditionally been underdiagnosed, and more women are dying from heart disease than men. There are many significant differences in the burden of disease from particular health conditions for females and males that must be considered when we're looking at implementing health education and looking at health services. So let's look at men here. Men have a higher proportion of tuberculosis, cancers of the liver, lung, stomach, and esophagus, more cirrhosis, alcohol and drug use disorders, unintentional injuries, and more injuries from violence and self-harm. So these are important to take into consideration from a male and boy point of view. Gender also plays into health. So gender is the social, cultural, and psychological aspects of being male or female, and they are shaped by the socio-cultural environment. Gender roles describe how our culture believes men and women should behave. For example, gender roles may indicate what tasks women are expected to do, like cooking, cleaning, and taking care of children. They may also define women to be under the authority of their fathers or other male relatives until marriage, and then under the authority of their husbands after a marriage. In many countries, laws restrict women's ability to own property and manage their own finance. And so these are some of the gender roles that culture believes for men and women, and in how men and women should behave. And so when we're looking at SDG number 5, we're trying to achieve gender equality and empower all women and girls. And the particular targets include eliminating all forms of violence against all women and girls in the public and private spheres, including trafficking and sexual and other types of exploitation, and ending harmful practices such as child, early, and forced marriage, and female genital mutilation. So achieving gender equity will require identifying and addressing the numerous preventable health issues that disproportionately affect women and girls, and at the same time, addressing the avoidable health conditions that disproportionately burden men and boys. Moving on to SDG number 8, employment of at least one wage earner per household is generally critical for keeping a household out of poverty. In addition to the income from working, employment often provides healthcare coverage, compensation for on-the-job injuries, and sometimes housing, food allowances, and schooling for employees and their children. And so these benefits can have a significant positive impact on the health of workers and their families. When we look at employment, we look at unemployment and underemployment. And underemployment occurs when a person is involuntary working part-time rather than full-time, or is a low-wage worker whose earnings are below the local poverty level even after working long hours. And so being underemployed or unemployed can be detrimental to mental and physical health status, leading to depression, suicide, and adopting unhealthy behaviors such as smoking and alcohol abuse. So I focused in on 3 specific SDGs. We looked at SDG number 1, reducing poverty, so income and wealth. We looked at the SDG number 4, which is education and literacy, and we looked at employment as well. And when we look at employment, economics, and education, they are all interrelated and they all link to health. And these 3 components contribute to the socioeconomic status of an individual or a household and are linked to each other in health status. And so any intervention aimed at one of these 3 categories may positively impact the others. For example, new reading skills may lead to a better job, increased job skills may lead to a higher hourly wage, and extra income may be used to pay for additional training. And so it's again important for nurses to understand that an improvement in any of these dimensions of socioeconomic status can lead to increased health regardless of where you live in the world. SDG number 10, reduced inequalities. We are going to speak to this SDG in lesson 2.3, so wait for that one. And lastly, good governance. So sustainable goal number 16 focuses on peace, justice, and strong institutions, and aims to promote peaceful and inclusive societies for sustainable development, provide access to justice for all, and build effective, accountable, and inclusive institutions at all levels. And good governance means that the processes and structures that enable governments to set policies, provide services, and protect human rights are at this level. So none of the other SDGs can be achieved when functioning health systems are not in place to ensure that everyone has access to health services, education, clean drinking water, and other tools for health. But what are some of the challenges against SDG number 16 and good governance? Well, one is power control, so the authority to control or influence the actions of others, and corruption, when politically powerful people abuse their positions for personal gain. So an inclusive society is one in which all people have equitable access to governmental institutions and services, including health-related services. Up next, we are going to discuss lesson 2.2, Health and Human Rights.